Hi, Dr. Andrea Maxim, naturopathic doctor here and the creator of the Maxim movement. Today's video is going to be discussing the importance of acid-alkaline balance, and this is something that I assess with all of my patients on the initial visit, and we continue to do so for months afterwards. The reason why is because if you are not able to maintain acid-alkaline balance, then most likely you will not be able to maintain optimal health. And that's really why people are coming into my office to see me, because they're just not feeling well. One of the clear-cut signs that your body may be too acidic could even be something as small as fatigue, difficulty losing weight, if your skin is getting really dry, if you have a lot of aches and pains, muscle pains, joint pains, headaches. All of these things could be because the acid burden is starting to overflow and we're not able to neutralize that acid by using healthy fruits and vegetables, lots of water, getting proper sleep, sleeping well, waking up rested. All of these things are so vitally important to keeping acid-alkaline balance in check. Now, the number one question my patients will have is, how is it that my body is getting acidic and what's actually happening here? The number one reason why our body becomes more acidic is chronic stress. And I know everybody watching this video has some form of stress in your life. And it doesn't mean that it's a negative one, but we are busy and we're very consumed with being busy. Whether it's not getting enough sleep, waking up early, having to go to work, pulling long hours at work, raising a family, taking care of our kids, taking care of our spouses. All of these things accumulate, and if we're not giving our body the nutrients it requires to heal and repair, then this acidic burden will start overcoming and overwhelming the body, and that's when we start to not feel very well. If it's not from chronic stress, it could be from poor choices with regards to your diet. So if we're not choosing those beautiful, colorful foods, and most people, especially in North America, are consuming a predominantly beige diet, then our body is also going to be lacking in a lot of those essential nutrients. Dark leafy greens are always the best, and we want to be aiming for about 3 to 4 cups of these dark leafy greens every single day, and of course organic is best. It could be that we're not sleeping well enough and we're not resting and repairing our bodies. So when we're constantly working, our body isn't given the time to heal and repair like it should. And for those of you that are working out a lot, often we don't find that it's the overtraining that's the issue, it's the under recovery. It's not getting those nutrients in at the right timing. It's not giving our body the ability to heal and repair. And even with muscle pain, when you're working out and you're feeling that muscle burn, what your muscles are creating is something called lactic acid. And that lactic acid essentially will create more acid in the body. So we want to be neutralizing that with things like magnesium, lots of water, getting your protein in to help rest and repair those muscles. We need to be flooding those things in. And if we're talking about extreme athletes or Olympians, these people need 20 times the amount of greens that average lay person would need. So this just gives you an idea of the harder we train, the harder we work, the more we have to do in our daily lifestyle, the more this acid burden is going to start being created. Now, the next question people ask is, well, how do I treat the acidity if it's in the body? And I've given you a few tips already. So lemon in your water is a great way of alkalinizing the system, so that sour flavor from the lemon really helps the liver detoxify. Getting those dark leafy greens in, getting your sleep, managing your stress are all some wonderful ways. But I wanted to take a step back in this video and describe the biology of what's happening with acidity in the system. So you're going to see on this illustration that I'm going to be drawing for you right now, so hopefully it turns out okay, exactly what's happening in the body and why the acidic burden can be so big. So here we go. So this piece of paper is going to be our drawing board, and this is your bloodstream. Now, your bloodstream must maintain a pH of 7.35 to 7.45 in order for your body to survive. If for some reason your blood pH falls out of this even by 0.01, you will die. And this is why it's so important to keep the bloodstream nice and neutral. What we have in our body to create this neutrality is something called bicarbonate. This bicarbonate is what is put into the bloodstream a minimum of 60% in order to keep that pH status working for you. What that means is for the rest of the body, like our brain, for our joints, for our muscles, the rest of the bicarbonate that we have in the body has to go here, which is anywhere from 40% or less. So if you're thinking about it, if you have chronic inflammation, chronic joint pain, chronic headaches, you're just not sleeping all that well, and this is all you have left to kind of heal the body, you can understand how that acid burden happens. So the big thing that we need to focus on is bicarbonate. Now, bicarbonate is something that you can get in a supplemental form. So in my office, we use different products that are high in bicarbonate tablets that you take right before bed. Some people even use baking soda in their water right before bed or something like that. I definitely don't encourage using just baking soda. I like to use the companies that actually have it jam-packed in and I know it's going to work. But this is just kind of the basics that I want you to understand. So, in summary, if our bloodstream falls outside of neutral pH and we do not have enough bicarbonate to maintain that as well as the rest of the body, the bloodstream is always going to win. So if your body is just not feeling well, if you're not able to repair, recover, most likely it's because that acid burden you have in your system is far too high. One of the ways that you can test to see if your acidic levels are too high or if they're okay is by doing urine pH tests. This is something I also get all of my patients to do at home, of course. And what you're doing is you're just grabbing some pH paper. I encourage patients to do it morning, afternoon, and evening and monitor where that level is. In the morning, it's okay for you to be a little bit more on the acidic side, but we're hoping sort of a light green, maybe medium green. During the day, it should not be anything other than dark green blue. And then by the end of the day, based on how busy you were and what your diet was like, it's also okay for that to be a little bit on the acidic side, and that's okay. These are just some basic guidelines where hopefully you can start reassessing some other reasons why your body is not feeling well. Remember, the whole point of this video is that we want to be maximizing our health. And of course, if you have any questions or concerns, you can always contact me. Again, I'm Dr. Andrea Maxim, naturopathic doctor, and the creator of the Maxim movement. And if anything, start drinking your water, eating your greens, and you will be maximizing your health in no time. Have a happy and healthy day.